Greetings and welcome to another installment brought to you by Mohamed Marrzooqi, Advocates and Consultancy, leading legal experts.
Health insurance imposed on the employer towards his employees in the Emirate of Abu Dhabi. Health insurance is one of the type of insurances intended to provide the necessary healthcare to the insured, where the insurer covers the cost of examining, diagnosing and treating the insured's diseases in return for a sum of money paid by the insured or his employer whom he works for on a daily or monthly basis. Thus, health insurance is one of the social systems put in place so no one enrolled in the health insurance will bear the cost of treatment alone. This system works on the principle of distributing the cost of the sick individual's healthcare to people enrolled in the insurance equally, in order to reduce the financial burdens imposed on the insured when suffering from diseases and injuries. According to this definition, there is four relationships imposed by the presence of four parties in the health insurance system, and these parties are defined by Article 1 of Law number 23 of 2005 for health insurance in Abu Dhabi as follows. Insured. This is the person who has been insured through the health insurance scheme. Employer or sponsor. Employer, a natural or corporate person who, within the limit of the emirate, hires employees or workers of any kind of pay. Sponsor, a person sponsoring a non-UAE national resident. The insurer, an insurance company operating in the state and licensed by the authority to provide health insurance services. Healthcare provider, government or private health centres licensed by the authority to provide healthcare services. The employer is obliged towards his worker to enrol them in health insurance system and to meet the obligations of this enrolment towards the insurance company, which is responsible for covering all the cost of treating the worker in accordance with the type of disease and injuries covered by the law, and pay this cost to the medical treatment providers until he is recovered. And therefore we find a tight bond from the worker to the employer to the health insurance company to the health care provider. This bond ensures that the preservation of the rights of each party and his commitment to his duty towards the other parties. However, one of the weaknesses in this bond is the failure of the employer to enrol his employees or workers in the health insurance system, which is what the law stipulated in Article 5 of Law number 23 of 2005 states. The employer shall undertake to provide health insurance coverage for all his employees/workers and their family members, including an employee/worker, wife and 3 children under the age of 18. Every sponsor shall undertake to provide insurance coverage for those sponsored by him who are not covered by the employers as of the date of arrival in the state. A non-UAE national may not obtain residence permit or renewal thereof, nor may be employed unless after enrolment in the health insurance scheme. The law that obliges the employer to provide health insurance coverage for all his employees/workers did not overlook the possibility that the employer may fail to meet this obligation, and so the law has specified a penalty for this in Article 24, which reads as follows. Any employer or sponsor who refrains from subscribing to the health insurance scheme or renewing the health insurance policy is punishable by a fine not less than 300 dirhams for each month not subscribed for the health insurance policy. This penalty will be compounded corresponding to the number of persons involved. The purpose of the penalty imposed on the employer or the sponsor for this breach of the obligations to enrol the employees in the healthcare insurance system shows the interest of the legislator and his keenness to apply this law because of its great benefit for the individuals and society. This system also benefits the employer, who gains from the return of a healthy worker to work for him, as well as the benefit to the insurance company, which is helped by the subscriptions of the insured and their increasing numbers to work efficiently and continue their work, which is to cover the cost of healthcare financially. And the last benefit of the health insurance system is for the medical service providers, who will continue to develop their medical equipment and improve the efficiency of their medical staff.
This message is brought to you by Mohamed Marrzooqi, Advocates and Consultancy. We do have offices in Dubai and Abu Dhabi. Please contact us for your consultation. Alternatively, you can visit our website, which is www.ml-advocates.com.